It's Women's Health Month. Today brings a focus on mammography through a visit to Northwest Radiology in Greenwood. News 8's Lakin McGee talked to one of the experts there.
Okay, ladies, it is time to get checked for breast cancer. If you're at the age of 30, you should have already had at least one risk assessment done. By the time you are age 40 and older, you have to be doing this annually. And joining me is Emily here. So Emily, just explain, how can people reduce their risk of breast cancer?
Yes, so they can exercise, eat well, drink alcohol in moderation. And while those things are hard to do, it's definitely worth it for your health.
Definitely. And you can also check yourself at home. So just explain how people can do that.
Yes, so every month you should be doing an exam on your breast, familiarize yourself with your breast, know exactly how they are, so if anything changes, you're aware of it. Some things you can do are raise your arms, make sure that they both move at the same rate, make sure they look the same when they're moving, put your hands on your hips, bring your arms forward and make sure they look the same, also bending over, making sure they hang the same, and just also be familiar, touch your breasts. It's okay to feel for yourself.
Okay. And explain what a mammogram is for people that do not know.
Yes, so we use radiation to image the breast. We're going to compress the breast to spread out all your structures, and then the breast will have radiation come through, and our doctors will be able to see those pictures, see if there's anything suspicious in there to be concerned about.
And is it painful at all?
It should not be painful. It could be a little uncomfortable, but the better compression we have, the better we're able to spread out those structures and see through and see if there's anything suspicious.
And we've been talking about, I have breast cancer in my family on my mom's side. So definitely I should get checked at some point. But people that do not have breast cancer at all in their family, do they need to get checked too?
Absolutely. 70% of women are the first ones in their family to get breast cancer. So it's really important for your health and your family's health to know if that's something that you have.
Emily, thank you so much. We appreciate it. Guys, you heard her. Come on down, get checked out. You do not need a doctor's order to do this. And I do want to say that this clinic here, this is brand new. So come on down, get checked out. It is one of the clinics on the north and south side of Greenwood. So they now have convenience for everyone in the city to get checked out. I'm Lakin McGee for Wish TV, wishtv.com, and follow us on Facebook.